those like her who are graduating with huge debts of thousands of pounds. And the reply sent to her MP from Helen Whateley read, student nurses are supernumerary and are not deemed to be providing a service. They are required to undertake 2,300 hours of clinical practice to learn the skills necessary for entry to the workforce. Whilst they may be providing limited clinical duties, this is under close supervision and they are not being paid to staff hospitals.
Well, Jessica joins us now from Peterborough, along with former Labour MP and nurse Eleanor Smith from Birmingham. Well, welcome to both of you. Jessica, it almost defied belief when I read Helen Whateley's letter back. The idea that student nurses could do 2,300 hours of work and it be deemed utterly valueless, and then add to the mix the fact that so many student nurses volunteered to go and fight on the coronavirus front line, and the fact that you, I believe, have left with huge debts from your training. You put it all together and you think, what a slap in the face to every student nurse in the country. I mean, before we go any further, how much in debt are you after training to be a nurse?
So I'll leave university with just over £60,000 of debt.
And what is the financial support that is in place? Because, of course, there was previously a bursary for those who wanted to study nursing. There is coming in a grant, which I understand is going to be coming in from September. The trouble is you fall through the gap, don't you, where you couldn't get the bursary,
yeah,
and now you're not entitled to the grant. So do you have student loans? Is that the issue?
Yeah, so we pay £9,250 for the actual university course fees, and then on top of that we obviously get the maintenance loans for living that obviously go towards basic essentials, essentially. So yeah, with all of that combined, that's obviously made it a huge amount of money. And like you say, my cohort and those after me, we were the first cohort that came in, and we're essentially, when we're on placement, we're paying for the sort of privilege to be there. And it's the most rewarding thing ever, don't get me wrong, but at the same time, you do feel sort of worthless, and obviously having it in black and white in that letter was definitely very upsetting for a lot of students that have put so much into this.
Because one of the issues was that you need help with the amount of money that you're paying. It seems completely unfair that there was a whole load of students who were funded by a bursary, and there are going to be students who get support through a grant, but that for a couple of years in between, there are students who are now facing, for doing exactly the same work and for contributing towards the NHS, training to be essential nurses who we value, that you are having to face debt for that. And I know you'd asked, hadn't you, could they backdate the grant so that would help you cover your loans? What seems extraordinary is that in the response to this, the Care Minister, Helen Whateley, hadn't just said, no, we're not planning to backdate the grant and give you the money, but then added in this line that you are supernumerary, which suggests you're surplus to requirements, and are not deemed to be providing a service. It's a sort of two-pronged attack on you, isn't it? That's how you felt.
Yeah, definitely. I think surplus to requirements can be deemed in different ways, but I think everybody knows sort of the pressures that the NHS has been under for a long time now. So I think it's safe to say that as students, very often, we're not surplus to requirements. And even though we are technically supernumerary, we're very much counted as help. And without that help, there would be a lot of sort of departments that would definitely struggle. Yeah,
well, Jessica, just tell us, what have you been doing through the coronavirus crisis?
Yeah, so me personally, I've opted in to sort of help during the coronavirus. So I'm on a paediatric A&E department. So I'm sort of supporting there. We aren't actually deemed supernumerary here, so we are counted as part of the workforce. And we're just doing sort of the same things, really, as we're working alongside our other qualified professionals. We're delivering care to the patients that come through those doors. We're taking our own patients, which is something that we often do. We have to do in order to be signed off. So I think there's a lot of sort of loopholes that have been found here to sort of put us into this bracket that the government want us to sort of be in.
Well, it's completely ridiculous. Let's bring in Eleanor Smith, Labour MP. Previously, you were a surgical nurse before that for 30 years. Your daughter is also a nurse, qualified last year, works on a respiratory ward, looks after COVID patients. So this is, you've been right at the sharp end of this, haven't you, with your family? It seems such a kick in the teeth to student nurses, this.
It is to student nurses and also to nurses generally, because if you think about it, they were student nurses. I mean, I spoke to my daughter yesterday and she felt so aggrieved by it. I don't think they realise when they make these statements what effect it has on the morale of the healthcare workers. And you say I worked 30, it was actually 40 years I worked in the health service before I went into politics. So I know, and I'm not surprised, because this government has no idea what it's like on the front line. Simple as that. And so when they make these type of statements, they're not thinking, they have no empathy for individuals. They have no empathy for our NHS staff.
Well, we interviewed Helen Whateley several times before the government boycott came in. It's now day 55 or 6 of their boycott of the show. And one of the main problems was the performances of people like Helen Whateley, who repeatedly came on here and didn't know the answer to basic questions about how many people were even dying on the front line in the NHS or care homes. Hadn't got a clue. And I found that just utterly breathtaking. So the way she's reacted here doesn't surprise me. I mean, I just find the level of incompetence of people like Helen Whateley is startling.
Exactly. And when you think about these students now, OK, students were working across the hospitals. They were working in the COVID unit as well. They were, just think about it, they were the ones as well that was holding the patients as they were dying for their relatives. Imagine that, OK? They also went in knowing that other healthcare workers were dying from the COVID-19. They also knew that there was a shortage of PPE due to this government, and then they said that that they don't provide a service. How insulting is that?
Yeah, well, let's bring Jessica back for one last word. Jessica, how are you going to pay back £60,000? I mean, I just find it staggering that we are saddling our nurses with these ridiculous debts.
Yeah, I mean, obviously it's going to take a lifetime if I even manage to do it, to be honest. I'm hoping that from this and from sort of the sort of uproar surrounding it, that the governments take a serious look and educate themselves on the role that we do play, and take into consideration the fact that despite how my cohort and those after me have been treated, we still stepped up when they asked us to. We still wanted to help on that front line despite the risks, and they need to look at that debt that we've accrued.
Well, they have a debt to you. We as a country have a debt to you and all the other nurses who were student nurses who stepped up when they were asked to do so, and it was an incredibly brave thing to do. Listen, thank you for what you've done in this pandemic. Thank you to all your fellow student nurses. I'm just so sorry you've been made to feel so worthless. I think it's disgusting.
I think there's two issues, aren't there? There's the words used, which just seem to, as you say, they've been so insulting and a kick in the teeth, really. But there is also this financial issue. We know there have been a couple of U-turns already on issues to do with NHS workers. We know that the government U-turned when Marcus Rashford launched his campaign to extend free school meals over the summer. Perhaps the government will listen to what you've said, both of you, and consider a U-turn on backdating the grant that is going to be available to student nurses from September.
That strikes me as the very least they could do.
Yeah.
And a public apology from Helen Whateley to every student nurse wouldn't go amiss either. Listen, thank you both very much indeed.
I know, Jessica, you're calling for an apology, aren't you? That you would like to hear her take those words back.
Absolutely. Yeah, absolutely.
Well, we asked for an interview. No one was available. The Department of Health, though, say Helen Whateley's words were taken out of context.
Why have we got to read this?
Well, I'm going to read it anyway.
Why?
In a statement, the
If
Care Minister said...
if the government won't come on our programme, why should we read their wishy-washy little statement?
Because I think it's interesting what they say.
No, if they want to have their statement read, come on the programme.
Well, can I read the statement?
No, don't bother.
Why?
Because if they're not going to come on... If they're boycotting us, I'm going to boycott their stupid little statements. Sorry.
Well, I'm not. I'm going to read it.
I think we should.
Well, you don't have to read it. Let me read it.
You don't have to read it.
Well, I'd like to read it.
Nobody has to read this.
I want to hear
can't be bothered...
I want to hear the government's explanation for why she
if you want to hear it, tell them to come on the programme.
The whole country is grateful to student
nurses. You come on the programme and you can read your statement to this
Supernumerary status for student nurses is a technical definition created to ensure they have the space and time
to learn. You're just reading a PR release for them.
And it is widely supported across the nursing profession.
Otherwise,
a strong financial aid package for nurses, and going forwards we have introduced even further support with grants to help with maintenance
is there no
and study costs which does not need to be paid back.
Sorry, apologies to all viewers that listened to that claptrap.